This is My 9 News.
Teens in plastic surgery, it's a growing trend across the nation and here in New Jersey. This time of year especially. Doctors report that young patients getting procedures to their prom or as graduation gifts. According to the American Society for Aesthetic Plastic Surgery, these are the top 5 surgeries for the under 18 set. 1, nose jobs. 2, ear surgery, usually to pin the ears back. 3, breast reduction. 4, breast implants. And 5 is male breast reduction. Now, doctors say that even though more teens are getting the work done, they only account for about 2% of all plastic surgeries.
Tonight, we're taking on the trend of teen plastic surgery and why they're doing it. Joining us now, Dr. Michael Fiorillo, a board-certified plastic surgeon, and 20-year-old Erica Pappas, who had breast augmentation surgery at age 18. Erica, first, let's start with the question, why did you get the surgery done?
Originally, just for myself, just for my self-confidence level.
Why the idea that you thought you needed plastic surgery?
Well, basically, I was just a little uneven, and it would just bother me when I would be at the beach or out anywhere. The clothing I would wear wasn't always, like, fitting me right, so that's basically why I did it.
You could have gone to Victoria's Secret. Why surgery?
I tried everything. I really did, and that seemed to be the only solution for me, I thought.
Dr. Fiorillo, don't you think this is a troubling trend, especially for young women?
Well, as long as the doctor and the patient don't get carried away and the expectations are realistic and everything is done in a safe manner, I think it's great.
What do you call carried away?
Well, more than one surgery, excessive surgery. I think if there's a good indication, which usually teenagers, breast reduction, rhinoplasty, and occasionally augmentation. I think in a safe manner, it's great for self-esteem.
Isn't all surgery risky? I mean, especially when you talk about just to even things up a bit.
Absolutely. The risks, although low, obviously are not zero. But you know, as long as it's a healthy patient, I would never operate on someone that wasn't healthy. But as long as they have clearance from their medical doctor and don't have any significant problems, procedures are very safe.
Erica, did you do this for prom season, graduation, any special occasion?
No special occasion. I just did it for myself, really.
How did you feel after it was done?
After it was done, I mean, there's a recovery time, and then afterwards I felt a lot better, a lot more comfortable with myself, and a lot more comfortable at the beach and in clothing, just in general. I thought it was great.
Do you know a lot of people who've had it done?
I do, and I know a lot of girls who have had implants and reductions, a lot of plastic surgery.
So what size did you go from, say, A to B, B to C?
A B to a C.
I understand she wanted more.
Yes, we talked about that, and the expectations really were to be even and symmetrical, which is a big thing. And, you know, for teenagers, you know, they have a lot of peer pressure and they start dating, so self-esteem is very important for them.
Dr. Fiorillo, do you have any age restrictions for this kind of surgery?
Yes, I won't do a breast augmentation on someone less than 18, and I think most people, doctors in the country, feel the same. So 18 is the cutoff. However, for other surgeries like rhinoplasty and breast reduction, 16, 17 is not uncommon.
So, Erica, what did your fellow students say at the time, or people who knew you?
My friends, they all thought they came out great. I'm very happy with the results. They were natural, and as long as I was happy with it.
Dr. Fiorillo, what other kind of surgery do people want to have done? Of course, we've talked about the rhinoplasty. Any other thing?
I limit myself to with teenagers. I mean, people ask for liposuction, which I won't do. Anything on the face, I won't do. Believe it or not, some teenagers ask for Botox and other things. Occasionally, a lip augmentation with a little bit of filler. But I really tend not to operate on a teenager unless there's a really, I counsel with them and their parent, and there's a really good indication.
Okay. Dr. Michael Fiorillo and Erica Pappas, thank you so much for helping us take on the topic of teenage plastic surgery.